Are you interested in helping us understand how to prevent the spread of COVID-19 in long-term care and retirement homes? Our research study explores this by looking at the number of people who have been infected with COVID-19 in long-term care and retirement homes and what factors may be related to COVID-19 infection. We are inviting long-term care and retirement home staff, their household members, long-term care and retirement home residents, as well as their essential care partners, caregivers, and family members to participate in the study. If you are interested in participating in our study, we ask you to do 2 things. 1. We would like to take a small dried blood spot sample from you. Collecting a dried blood spot sample involves a brief finger prick, similar to how patients with diabetes test for blood sugar levels. From your dried blood spot sample, we can measure your antibody levels against COVID-19, determine the number of people who were infected with COVID-19, and better understand the relationship between antibodies and infection. Antibodies are protective proteins produced by our bodies to help fight off viruses. 2. We would ask you to complete a demographic questionnaire, which is a short survey that asks you questions about things like your age, race, and neighborhood characteristics, so we can understand what might increase or decrease someone's chances of becoming infected with COVID-19. If you agree to participate in our study, we would also ask you if you would be interested in some additional optional activities. 1. We would also like to link your study information to your Ontario Health Card, or OHIP card. By linking your study information to your OHIP card, we can learn how COVID-19 infection may be related to healthcare system use, such as hospitalizations, and health status, such as other health conditions and vaccination status. Please note that this study activity is optional and your OHIP information will only be used for these study purposes. 2. You will also have the option of participating in additional research opportunities related to COVID-19 that are being led by some of our colleagues at Mount Sinai. You can find more information about this in the consent form. If you want to be contacted about other COVID-19 studies, we will securely transfer your name and contact information to our partner hospital, Mount Sinai. There are a few things you should know before participating in our research study. You may experience minor pain and/or bruising at the site of blood collection, but don't be alarmed as this is normal. Once your sample has been analyzed and we have received your antibody results, we will contact you. Please note that this can take a few months. There is a very low risk of your information being stolen or lost. The study team takes all possible precautions to protect the privacy of your information. All electronic, hard copy, and audio information will be stored in our Unity Health Toronto secure servers for 7 to 10 years before being destroyed. Blood samples will be stored at St. Michael's Hospital, Unity Health Toronto, for 7 years before being destroyed. By being a part of the study, you are sharing important information that will help us in the fight against COVID-19. Your sample and any information you provide us with for the mandatory activities will have a study ID assigned to it, and only the central research team will be able to link your information back to you. If you participate in the optional activities, your information will be shared with the people who link your study information to your health card and/or the research staff at Mount Sinai. Your information may also be shared with other researchers, but they will only have access to your study ID and not your name, meaning they will not be able to link your information back to you. And lastly, if you, at any point, decide you are no longer interested in being a part of our study, you can stop participating at any time. If you are still interested in participating in our study, please take some time to read through the information sheet and consent form. If you have any questions, please contact the Wellness Hub study team through our email at wellnesshub@unityhealth.to or leave a voicemail at 416-864-5697 and we will get back to you.